Hello, everybody. Thank you so much for being here for Wonderland's latest webinar on prenatal substance exposure. I'm Liz Flores-Marcus, and I'm Wonderland's Chief Investment and Partnership Officer. And this panel is focused on challenges facing school-age children that have prenatal substance exposure, or PSE. There are a lot of misconceptions around PSE. One of them is that it really only affects newborns and infants, and once the detox happens, a child is in the clear. But unfortunately, we know that many of the impacts of PSE really start presenting once a child enters school. So we have a panel of experts who are going to talk more about some of these issues and available resources and tools to help support school-aged kids that have PSE. And I'll just say I feel really fortunate to get to talk with this group. Just really bring wonderful perspectives and experiences to this work. Wonderland has been around for over 50 years, serving children with disabilities through our early support program for infants and toddlers. And in 2019, we opened Hope Rising Clinic for prenatal substance exposure, where we serve children birth to age 13. And it is still the only clinic in the region and the state offering comprehensive PSE services for children all under one roof. But we're working really hard to change that and share our model, which I will talk a little bit more about toward the end of the webinar. But one thing we always like to acknowledge up front is that talking about prenatal substance exposure and hearing about prenatal substance exposure can be really challenging. It really is a sensitive topic, but it is so important that we do talk about it and learn about it. So I want to thank everyone for engaging on this topic and being willing to listen and learn and share. Our goal is really just to get these services to the kids and families that need it. So our panelists here, we have Jennifer Wisdahl, who is the Chief Operating Officer with FASD United. Jenn leads the legislative and policy agenda. Jenn is such an amazing leader in the FASD world and beyond. She's really a tireless advocate for people with FASD. She's been an incredible partner and mentor to us at Wonderland and Hope Rising Clinic. We're very, very lucky to have her as a returning panelist. And we have Shina Cook, who is a speech-language pathologist at Hope Rising Clinic. Shina has so much great knowledge and experience to share, so I'm really looking forward to hearing from Shina, and she'll talk about some of the work specifically happening at Hope Rising Clinic. And we have Sara Lawton, who is the parent of a young man with FASD. Sara and her family have been through Wonderland's early support program as well as Hope Rising Clinic. And man, Sara is such an incredible advocate for her son, particularly when it comes to schools and educators. The work that she's done and the tools that she's developed are really something. So really, really excited to hear from her. And with that, we will get into the presentations. We have been collecting questions from our audience, and we'll do a question and answer Q&A at the end. And we also invite those of you watching to reach out to us if you have any questions we didn't cover. We'll pull up an email address and you can reach out to us and we'll do our best to answer your questions. So with that, I will hand things off to Jenn.
Well, I don't know how I can possibly live up to that introduction. Thank you. Really appreciate that. My name is Jenn Wisdahl, and I do work for FASD United, which is the national organization that supports individuals with fetal alcohol spectrum disorders based out of Washington, D.C. I am fortunate enough to be able to live and work in the great state of Washington. You could say I'm bi-coastal. And in addition to working with FASD United, I am the proud parent of 3 young adults who also have FASD. So this is a topic really near and dear to my heart. And I think an important thing is to start talking about prenatal substance exposure and FASD out loud. When my kids were first diagnosed, it was suggested that I don't talk about it publicly because that would expose myself and my kids to stigma. And that stigma definitely does exist. But I think only by talking about it in a non-stigmatizing way are we going to get through that. So I want to give you a little bit of information on prenatal substance exposure and then also on FASD. So FASD is a lifelong condition that occurs when a developing fetus is exposed to alcohol. And that can happen at any time during the pregnancy, even prior to recognition of pregnancy. We know that 10%, at least 10% of pregnancies are alcohol exposed. And with 40% of pregnancies, over 40% actually being unplanned, we know that FASD is going to happen wherever alcohol occurs. And it does happen quite frequently at a rate of 1 in 20. And you think about that rate of 1 in 20, that's 2.5 times the occurrence of autism. So 2.5 times more prevalent than autism. 1 in 20, that's a kid in every classroom. That's a person on every ball team. That's a person in every workplace. So FASD is around us. And I think by having these conversations and the conversations that Hope Rising Clinic and Wonderland are having, we're going to learn more about it and how to support people with FASD and with PSE. And we know from the CDC that more research is definitely needed on what the long-term outcome is on prenatal substance exposure, on exposure to drugs like opiates, and the long-term prognosis for folks with prenatal substance exposure. And we know there's some research that's been done on the long-term prognosis for people with an FASD. So bringing it into Washington State, right, hitting us here at home, we know that FASD is highly prevalent in our school system. If we look just based on that 1 in 20 number, that's 54,000 kids with an FASD in our school system currently. But we're not really equipped to deal with that. In Washington State, we have 4 diagnostic clinics, none of which diagnose full-time for FASD, even though FASD was first diagnosed in the US 50 years ago this year here in Washington State. We also know that co-occurring mental health challenges, mental health conditions are the norm with the FASD population. But unfortunately, many of our typical go-tos for mental health don't work with the population for FASD because of a disconnect between cause and effect thinking. FASD isn't really tracked in schools. There's no mechanism for tracking it because it's not covered or not a designated condition under IDEA. So the schools don't track how many kids in the school system have FASD. As a matter of fact, and just anecdotally speaking from my kiddos, most schools have no idea what FASD even is. They might know about pieces of it, but they don't really know how to support students with it. They haven't had training in it. They haven't had any kind of materials rolled out to them, and it's just not on their radar. And so we know from the research that kids with FASD, students with FASD, face higher than average school exclusion rates. And that's unfortunate because it doesn't have to be that way. So FASD United recently completed, and I mean very recently, this is hot off the press, a national education survey for professionals who work in the education system with students with FASD, parents and caregivers of school-aged youth, and also adults and adolescents with FASD. And we talked to them about their school experience. And we know that the IEP process is generally covering students with an FASD, but it's covering them under the category of other health impairment, right? So there's no guidance at all to the school in terms of how they would support these children. We know that 33% reported in-school suspensions, 39% reported out-of-school suspensions, and that 61% had spent time in a timeout or de-escalation room, which usually involves some amount of seclusion. 26% of students experienced restraint. And, thinking about the trauma of that, the trauma of being restrained in a school setting, that's not helpful for any learner. And I know Washington State ranks very high in the list of states that use restraint, exclusion and restraint, and they're working hard to fix that, but that's where this population is coming in. 98% of the people surveyed in this study felt that not having an IDEA category for FASD was a barrier, was discriminatory and a barrier towards getting the services that learners needed in school. And then we know, again, that over 90% of individuals with an FASD develop co-occurring mental health conditions, but 85% of the self-advocates stated that school had a negative or adverse impact on their mental health. That's hard. That's a challenge. I can say I've seen that in my own family. And so there's a lot we can do to support schools and support families and support people with FASD to have a better experience in our education system. Navigating support can be a bit of a challenge there too at this point. DDA services currently aren't available in Washington state to most people with an FASD, whether they have a diagnosis or not. There's an IQ cutoff that is going away in 2025, but still there's that barrier of not having adequate diagnostic capacity to be able to get services that are tailored to their individual needs in the education system. And we know that there's a high percentage of the people diagnosed with an FASD are diagnosed while they're in the foster care system. And that doesn't mean that FASD is a condition that only occurs in youth and care. Actually, FASD occurs all over the map in every social economic system. But unfortunately, because of stigma around talking about prenatal substance exposure and talking about prenatal alcohol exposure, often it's only coming through families that are connected with children who are in the foster or adoptive system. And we know that rare gems like Hope Rising Clinic, they really are a rare gem throughout the country. I know of only a handful of agencies that have training on evidence-based programs for working with this population. And Hope Rising Clinic through Wonderland really has a great base of support and training on these evidence-based programs to work with school-aged children and their families to support them in having success while they're navigating the education system. So this all sounds very bleak and dire, and there's a lot that we can do though, and there's action steps that we can take and that Hope Rising Clinic and Wonderland are taking to improve things for individuals living with an FASD. But I did want to throw in one quick little resource at the bottom of this slide here. FASD United does have a family navigator program where anyone can call in or connect with our family navigators who are peer support people who will help direct you towards some of those rare jewels like Hope Rising Clinic that have the evidence-based programs or mental health support or other ways they can support families with prenatal substance exposure. And there's no diagnosis required to access that support. The other piece of hope I want to give is the FASD Respect Act. This is pending legislation federally. So I know there's been some great advocacy work in the state of Washington working on getting more support for individuals with prenatal substance exposure. And again, I want to give a great thanks to Wonderland and Hope Rising Clinic for doing the lion's share of that work. But federally, Senators Murkowski and Klobuchar have introduced the FASD Respect Act along with Representatives Betty McCollum and Don Bacon. It's bipartisan legislation that's looking at giving funding back to states to help support them in looking at all these different systems of care that our people with prenatal substance exposure interact with, and figuring out how we can integrate care for those folks into our existing silos. And we're really hopeful that this legislation will be passed in the next 13 months, and that would help bring additional support for families like mine here in Washington state that need the help that Hope Rising Clinic and Wonderland are providing, but maybe there's just not enough of it to go around. And so how can we expand upon that great work? Well, thank you.
Thank you so much, Jen. I really appreciate you sharing your own experience as a parent, as well as some of those stats around what's happening currently with kids that have FASD in schools. And I think most of all, I appreciate your emphasis on hope We know that the stats are bleak, but there is support out there. And the work you're doing on a national scale for the FASD Respect Act is huge. We are so hopeful and supportive of that work. So thank you so much, Jenn. And now we will hear from Shina.
All right, great. Thank you so much. Let me share my screen. All right, my name is Shina, and I am a speech language pathologist at Hope Rising Clinic. And I see a multitude of kids with varying degrees of prenatal substance exposure, and I'm really excited to talk about my experience. So as Jenn just discussed, at Hope Rising Clinic and just in the United States, an estimated of 1 in 10 children are born with prenatal substance exposure. And FASD is the #1 cause of intellectual disability in the United States. And over 80% of children with prenatal substance exposures are exposed to more than one substance. So as a result, that does lead to this unknown a little bit of the behaviors and the changes that we may see in the kids. And frankly, it is associated with several different types of brain differences and physical differences. So Hope Rising Clinic was designed to be a place that provides mental health, occupational therapy, and speech language assessment and therapy services for children's birth to 13 with prenatal substance exposure. And like Jenn had mentioned before, this is a unique setup for a clinic. Not a lot of clinics have that experience or that goal. And our providers are very uniquely trained to provide trauma-informed care through very specialized services. And we use a very specific neurobehavioral lens when we look at the behaviors and the differences of the children that we serve. So the main thing that I really want to talk about is executive functioning, because it is the primary area of difficulty that our kids face. And not a lot of people know much about executive functioning. People know a lot about gross motor skills, fine motor skills, language development, and those are the typical areas that we're looking at when kids are developing. But executive function really is the driving force behind the skills that we use every day to plan and execute daily tasks. To even just plan out what you're going to do next requires a lot of different skills. And these things do live in a part of your brain called the frontal lobe. So I really want you to think about the different areas that I'm going to talk about and how you use them every day. Even just right now, watching this video, attention, inhibition, emotional control, making sure that you're attending to the video, inhibiting your behavior to look elsewhere, do other things, planning and prioritizing. And like I said, emotional control, that's a big one. When you feel upset, being able to manage that, working memory, remembering what I just said on the last slide, task initiation, organization, flexibility, being able to shift between things that you're interested in or maybe not interested in. And prenatal substance exposure has a significant impact on executive functioning skills. In fact, it's one of the main things that is impacted. And since these are things that we don't really look for, it's often missed. But you can imagine with all of these different domains, if any one of them are impacted in our kids, how that will affect their ability to succeed in a school system. So school performance is one of those big things that we see as an area of challenge for kids with prenatal substance exposure. And one of the biggest problems is that they go undetected because a lot of these kids appear to be typically developing based on traditional developmental expectations, specifically when it comes to cognition, communication, and motor skills. And yes, absolutely, there definitely are kids with FASD and prenatal substance exposures with more needs and with more obvious difficulties, and they may receive services earlier, but there are also quite a lot of kids out there who appear quote unquote normal and don't receive the services. And then when they reach school, they are less likely to get the services there either. And then they receive these demands and these expectations to sit in their seat aligned to a school schedule. And those things are not skills that they may have developed because of these challenges with executive functioning. And success in school is less about your inherent intelligence, and it's so highly dependent on executive functioning skills. I mean, 8 hours a day as a young kid on even without executive functioning difficulties can be challenging. But then if you add any challenges with executive functioning on top of that, it can be incredibly hard to access the curriculum. So I want to give some examples of ways that executive function can impact, or at least challenges for executive function can impact school performance. So for example, let's think about like the structure and schedules of a school. And you wake up at a very early time. For a lot of these kids, they're at school by 8, maybe 7, and they're expected to be there till 2 or 3 or so. That's a long time. But another thing that our kids really deal with are transitions. So all the parents that I've ever talked to, all the kids that I work with, one thing that their parents will tell me is they really struggle with transitions. So moving between tasks, leaving the clinic even. I have a kid who really has a hard time leaving the clinic because that transition from one location to the next can be so challenging. They do not have the skill yet to flexibly shift between those tasks. But then you also see it in smaller scales, like moving from task to task. Maybe they're coloring 1 minute and suddenly they have to do math. That's a transition too, and that requires mental shifting. But then also planning for homework. So kids who really struggle with organization, planning for when they need to get their homework done. And this is really for those older kids who are expected to have multiple sets of homework every day. But then another thing is social interactions. So school is more than just academics, right? It's kind of our kids' first real exposure to peer engagement, social interaction. It's like practice for adulthood, you know, and that peer to peer interaction, but also student to adult interaction and making friends, being a good sport. Those things all require executive functioning skills. Because imagine I have kids who really struggle with the concept of winning and losing, right? They need to win. And it's almost painful for them to experience loss because they don't have that emotional control regulation skills. They really struggle with seeing past the event that's occurring, which is the competition. And losing feels so incredibly hard for them. And that's really hard when you're trying to make friends with kids who are maybe more typically developing or have those more developed executive functioning skills. They see that they don't see a good sport. They don't see a good friend there. And that can be really hard. But then also there's the flip side of that is making friends. A lot of our kids with prenatal substance exposure have a hard time reading social cues. And that means that there's a lot of missed opportunity in communication and also a lot of opportunity to be taken advantage of by other students. And so teaching these cues and these things are so hard because we don't typically teach that to our kids, our typically developing kids. We don't sit them down and talk about these nonverbal interactions. We expect that to just develop. So a lot of these kids enter a social realm and they don't have the skill set yet to navigate it. But another big one that I hear from parents is that their kid lies and that they hear a lot of lying from their kids and they don't know if they're telling the truth about their day but the reality is without that working memory skill, they are filling in the gaps. A lot of the times it's not a lie if it's not intentional. They're trying their best, but without this understanding that these challenges that these kids are facing, a lot of parents are going to assume, and caregivers and teachers and adults in general are going to assume that this kid is a liar. And then even then, behavioral expectations, right? Like now with zero tolerance policies, this expectation to stay in your seat, stay in the classroom, don't move, calm body, listening body, all of those things are incredibly hard for kids with executive functioning difficulties, right? Like this need to move, you know, sort of like the stimulation, the sensory needs, even just raising your hand to talk, you know, that is inhibition, right? Being able to inhibit yourself. Without that skill, you're going to blurt out, and then you're going to once again be labeled as kind of a problem student. And then finally, after all that, we get to learning in academics, which is what we think of as being the whole point of school. Executive functioning plays a huge part in literacy in test taking, and even just organizing your materials. Learning how to read is, as a speech language pathologist, knowing the concept of written language and having to go through those steps for the science of reading. That is like several different executive functioning domains at once. And it can be so hard to access those skills while you're still trying to be on your quote unquote best behavior with the behavioral expectations, the social interactions, and even the structure of academics. So I really want to talk about what the concept of a behavioral lens is, and then a neurobehavioral lens, which is really what the core of Hope Rising is about. So when we label kids based on their behaviors, like I had noted earlier, you know, kind of these problem kids, these kids who are liars, these kids who aren't good sports, things like that, we are seeing them from a behavioral lens. We're not seeing them from the differences in their brain and the way that they're experiencing the world. And as a result, I mean, like Jen had mentioned earlier, we have punishment systems in place, right? Like we have reward and punishment. Even sticker charts don't really work because it requires all of these executive functioning skills that are necessary for the concept to stick. But then we've got suspensions, we've got low grades, which can prevent kids from moving forward in academics. We get just the label of being a bad student doesn't make kids love school. And so, I mean, we think about like there are kids who don't listen, they're poor attention, they just want to play, they don't want to work, they're lazy, or perhaps they have a hard time shifting from task to task. Maybe they have poor initiation skills. Maybe they're just really struggle in those areas. But then I see a lot of kids who are labeled as instigators, manipulative, disruptive, like they have this intention of getting on your nerve. And it is problematic, because I don't believe that kids really truly come with that negative intention, but it's those executive functioning skills that make that environment really difficult. And then, you know, trouble making friends, trouble telling you about what you did that day, and then not trying, seemingly unmotivated to learn. A lot of these times parents or teachers or anyone will try, you know, sticker charts or timeout or all of these things to try to change this behavior, when in reality it's not a behavior to be changed, it's a skill that needs to be worked on and addressed. And the recognition of executive functioning challenges due to these brain-based differences will make all the difference in the world, because they'll get that access to support and accommodations, and will learn just that much more about who this kid really is, rather than the behavioral label that we give them. So I love this quote by Dr. Ross Green, that kids do well if they can. And kids really do well if they can. Kids don't intend to be bad kids. There's a lot of the times there's just this placement of expectation upon them that they do not yet have the skills to manage. So we can really support the development with the identification of that need, and then also with therapeutic intervention, as well as accommodations. So speaking of how Hope Rising Clinic, as a clinic, as a model, we support executive function. All of our domains, all of our specialized services provide executive function support, but it does depend kind of on what specifically needs to be addressed, right? So mental health, for example, our providers really help with emotional regulation, coping skills, working on impulse control, self-awareness, but also they really work hard on self-esteem. Like a lot of these kids, they're very bright. They can pick up on the fact that they're different, and they can pick up on the fact that adults and their peers speak about them like they don't understand, or they're not the same. Occupational therapy, they really work on a lot of areas like sensory processing, bodily awareness, establishing routines, which is very important for our kids, working on attention and problem solving, as well as those motor skills. And speech therapy, like myself, while I'm happy, I love working on articulation, I love working on language, but there's more than just that. We work on working memory, planning and sequencing, conversational skills, teaching what the nonverbal and social communication expectations are in the world, because a lot of the times that's a hard thing to teach, right? Because we don't typically talk about it. It's nonverbal. It's something that just happens. But also Hope Rising provides caregiver support and education, talking about reframing behaviors from a parent perspective, implementing accommodations and change at home and at school. So in short, in conclusion, there are so many kids out there with brain-based differences due to the fact that prenatal substance exposure is not identified very easily. And that is either because they score too high on assessments, or they just appear normal, or like we said before, the stigma of it in general. But there's also a big lack of awareness among therapists too, and parents about these brain-based differences. Not a lot of speech language pathologists that I know have ever worked with kids that they know of with prenatal substance exposure, even though they probably have. They just don't know. And what are the things that we can do? Well, first, we need more providers, right? We need more providers with the training. We need more providers with the knowledge, and just more providers to support all these kids, because the reality is a lot of these problem kids are just kids who need some more support, as well as more awareness among caregivers, teachers, and professionals, just to increase that identification. Maybe you're not equipped to handle the prenatal substance exposure, but if you can identify it, you can find somebody who is. And then ultimately, more understanding. Most of our kids are trying their very best. In fact, I would say all of our kids are trying their very best. And even if we can't see it, it may seem like they're not, but we can't always see what's going on inside their head. So I always say to presume competence and to presume that they're trying their very best. And so, like I said, more is more education, more awareness, and more understanding. And that is all. Thank you so much.
Thank you so much, Shina. Wow, that was really informative. I really appreciated a lot of the distinctions you made around executive functioning, and specifically how executive functioning and intelligence can be conflated, which really doesn't serve these kids or help them, thrive in school. And executive functioning, I mean, it really impacts just about everything we do, but it's not usually talked about. And it's such a major challenge for kids with FASD and prenatal substance exposure. And I also just wanted to say, I really like how you broke down the neurobehavioral model. And, these aren't bad kids or bad students. They have brain differences and really limited access to services. So thank you so much, Shina. I really, really appreciate that. And now, Sara, over to you. We're really excited to hear your experience as a parent.
This has been phenomenal. This is so exciting. So I have been a parent now for 12 and a half years. Our son came to us through kinship care. A relative was unable to care for him, and he ended up being placed with us. And it's one of the best things that's happened to us, because he's so awesome and we just adore him. When he reached 3 years old is when we started preschool, and we were lucky enough to have a preschool in our school district that takes young kids. So we started with them, and that's where we ended up having his IEP for the first time. So we had a great transition. Wonderland, at that time he was receiving services through Wonderland, and they helped us do that first transition, which was great and lovely, because they're just the cutest little things when they're 3. But it was, as soon as he entered preschool, we noticed a big difference. There was a huge challenge that we started having with the school. So just having this very young child going to school, and then having the staff not really understand him or really be able to grasp what was going on with him, was really difficult. So getting them to understand that he had a disability, even though he looked typical developing, was really difficult. We struggled with having the staff not realize that it's an inconsistent performance is typical for kids like my son. So the fact that he could do something, he could share his toys one day but not the next day, was really a struggle for them to not blame behavior instead of what was going on with his body and his brain. As he went through school, we have been very lucky to have some really good staff members, but then overall it's been a struggle, just the consistency of having to always retrain and redescribe to every staff member what was going on has been a little difficult. Overall, it's just kind of a struggle to maintain a united front between school and home. And that's okay, but it's difficult, and as we get frustrated as adults, we can tell that he notices that we're frustrated with the school system. Yeah. Some of the strategies that we have developed for dealing with the school system has been, over the years, we have perfected, at least I would like to think that we have perfected, a get to know you letter that we send to staff before the start of the year. We have worked into his IEP that he has preferential class placement. So as soon as they know which class he will be in for the next year, when he was in elementary school, because it's just one class, but we would know, so that we can reach out to that teacher and start to make connections with that teacher, so that it isn't something that's left until the day before school starts, that we need to be able to communicate things about him before you have less than 24 hours that you meet this new child. So that's one of the things I think has been the most helpful, is that accommodation for our family to be able to communicate with the teachers. We always suggest different books, different podcasts, different trainings in the nicest way possible. I'm always sending emails to staff and being like, oh my gosh, hey, I found this thing and I think it would really help with our son, and this is where it is and this is how it is. We always fill out every year, we fill out the communications between our therapist office and the school district, so that our teachers, we encourage them to reach out to Hope Rising Clinic and chat with them and talk to them, because Hope Rising Clinic is always amazing about educating other people. If I find a piece of media or books that I think would really help work with my son, I highlight them and then I give them to the teachers, so that if they only have 5 minutes that they can look over something, they'll know exactly what I want them to look at. The hardest thing I think I've done is turn myself into an advocate for my child. And that is not something that has come naturally to me, but it's something that I knew that I had to do. So the experience it was a really rough thing to go through. My son was in preschool and he was having a really hard behavioral time, and it was the second year of preschool. We were trying out a longer day. There's all these things going on. And I had an exasperated preschool teacher say to me, you need to get this under control, this meaning my child. You need to get this under control before he turns out like his real mom. And that broke my heart, because I realized that they looked at him, not how I looked at him, as this sweet, lovey child who struggled, but they looked at him as a thing, or as a problem. And I never wanted my son to have to sit in a classroom with someone that didn't honestly enjoy him ever again. And so that was the turning point for me, where I realized I really need to understand the school system and really get on this and turn into an advocate for them. So what I've done is I make myself known to staff and school personnel. I'm probably kind of annoying to them, and that's okay with me. But the more that they know me and the more that I can reach out to them, the more they can learn about my son. So I've also gotten involved in things with the district, who also advocate for children. Our district has a great special education PTA. It's a whole district from preschool to transition program, so you can stay with kind of it for a long time. And it's all people whose students have IEPs or 504s, and it's a great for learning. It's amazing for learning different techniques and learning different accommodations and finding other hyper local people who may have kids with the same diagnoses as your child and what's worked for them, who hasn't worked for them, things to be aware of within your own school district, which has been amazing. The other thing I developed was an elevator speech about FASD and prenatal substance exposure. So if I get the school superintendent for a minute, just walking down a hallway, I have something that I can whip out and just chat about for a minute, 2 minutes, and be able to get my point across as concisely as possible. It's really easy to talk about the things that have gone wrong in our school journey, but there are a lot of things that have really, really gone right. So we've had 3 amazing years with amazing teachers and amazing staff, and the difference has been incredible. The difference that it makes in my child's life. He has less instances of behavior, less school expulsions, less in-school suspensions, better behavior at home, just happier overall, fewer suicidal ideations. It's incredible. We had his first grade teacher was honestly another one of those like life-changing events where she honestly really enjoyed him and really liked him and wanted him in her class. She fought for him to be in her class. She has remained a person that I can reach out to if I have questions about school. She still, contacts us for updates and is like, how's our boy? And just the ability to have staff members that really, really have enjoyed him has been great. They've, when COVID happened, they came and played catch with him, just to keep that connection. They, will want him in their class. One of his middle school teachers came to one of his swim meets. It was down in Federal Way. We live north of Seattle. It was a drive. I'm thoroughly impressed that they made it all the way down there. Those times have just been phenomenal. If I can share a really quick story about his first grade teacher, because I absolutely adore her. She always told us all the stories of him during his day with like such a big smile on her face because she enjoyed him. But there was a day where she was like, he was in his groove and kept repeating her name over and over and again, like, Mrs. Teacher, Mrs. Teacher, Mrs. Teacher, Mrs. Teacher. And she was like, okay, like, we're done. Nobody's gonna say my name for like 5 minutes. Okay, we're gonna chill for like a couple minutes. And my son was behind her and he goes, and then called her by her first name. And she goes, I lost it. I couldn't hold it together. She's like, it was so funny. And just to be able to have other people tell happy stories like that about your child, and especially because school is such a huge part of these kids' lives. They're there for so many hours. It's amazing. One of the big benefits that we've had since starting all of this has been Hope Rising Clinic. It's been amazing. The things that I have really, really enjoyed is never having to explain things or have to train the staff. There's been other times when we had therapy where I had to explain and train the staff on how to work with my child. I realized after 6 months of appointments, my kid actually had never come back, had come to like 3 appointments and then never come back. And it was just me explaining how to work with my child to somebody without my child in the room. And I was like, why am I doing this? I've never had an experience like that with Hope Rising Clinic. It's been completely a whole family type of care. The staff checks in with me. They've asked me how I'm going. What can they do to help me? I've struggled with different things of like, I don't know where I want to get him into this, but I don't know how to start. I want to get him into swimming or horseback riding or underwater basket weaving. I don't know. Pick a topic. And the family advocates have been like, cool, I'll look into that for you. Is it okay if I do that? And I can send you some links. And it's amazing to feel like you have a partner and support for your whole family and not just for the child that's receiving care. It's been absolutely amazing. And we 1000% need more services like this because there's such a huge number of people that are affected and there's not enough services. There's absolutely not enough clinics, and my child is 12 and a half, and as we are staring down that 13-year-old cutoff, there's not another specialized clinic that we can think of. These everybody starts as these babies, these grows to kids, and these kids grow to teens, and the teens grow to adults, and they still need that high level of support. But currently it's not being funded and we don't have that. But that's why we need more services like these.
Thank you so much, Sara. Wow, so well said. I just, man, so many things that you said just really stood out to me. I so appreciate your point about how difficult it is and exhausting it is to constantly have to explain and re-explain your child's disability to people. And I really liked, how you said that he notices when we're frustrated and when we're frustrated with schools. And it really reminded me of Shina's point that these kids pick up on how they're perceived. And if we treat them as bad kids, or if they are perceiving themselves as bad kids, then they're already at a massive disadvantage. So just want to say, Jenn and Sara, your understanding of FASD and PSE as parents and the advocacy that you do for your kids is so inspiring. And Sara, I love too that you provide cliff notes with the highlighted sections. And I want to see that elevator pitch one of these days. The last thing that I'll say is just that Sara's son is a truly hilarious kid. He is so witty and he is so funny. And they actually participated in our latest video. So you can hear from him directly. If you go to our website, if you go to Hope Rising Clinic or the Season of Wonder website, you can see a video featuring Sara and her son. And you'll probably be cracking up. He's just so funny. So I just want to thank you again. And I think now we can go ahead and move on to the Q&A. We did collect questions from our audience, and so we will get through as many of them as we can. If you have a question that has come up over the course of this webinar, please send us an email and we will do our best to answer that question. But one question that I really have for the whole group, and Jenn, maybe you can kick us off here with an answer. What do you really see as the greatest challenges facing school-age kids that have FASD or prenatal substance exposure?
I think it's just a lack of understanding and awareness. I think our schools do not understand or have enough information to really be able to support our kids the way they need to be supported. Shina touched so brilliantly on the executive function struggles. And, Sara brought up as well, too. This is another one of those situations where we as the parents are educating the professionals. And, I laughed when Sara mentioned, every year I have to go in and I have to re-educate the teachers and re-educate the team. And I feel that so acutely. And we know that our educators are under a lot of pressure. We know that our educators are all really trying to do the best they possibly can. So this is where getting some more support for them and a mechanism for them to understand our kids would help in the classroom, it would help in the home, and it would first and foremost help the students.
Great, thank you. And how about you, Shina?
Yeah, actually, so I have one specific concrete thing that I think is a big challenge that these kids are facing, and it's literacy. I think literacy has been maybe the #1 concern that I have seen with the kids passing through our clinic, because it requires so much executive functioning skills. And testing has changed in the United States, of course, like we all know. It's a standardized testing world now, and we rely very heavily on this ability to read, which comes naturally to many of us, to be honest. But for those with executive functioning challenges, it requires some more focus, which they're unfortunately not getting at the school age. And so if I would say that there's one big challenge, it's that, because eventually you go from learning to read to reading to learn. And once you've missed that cutoff, you are missing out on a lot. And I just want to see that gap be closed for our kids.
Yes, well said. How about you, Sara?
I think one of the hardest things is that like super concrete thinking and lack of cause and effect, because all of the school like disciplinary things, PBIS, all of that kind of stuff is all based in cause and effect. This happened, then this happened. And if you can't make that jump between the two, it's arbitrary. I'm in trouble. I don't know why, and I don't know how to get out of trouble. So I might as well just be that kid. And so I think that's one of the hardest things for our collective population to really grasp.
Thank you. So this is one that Sara provided some really, I think, helpful and tangible tips. The question is, how can caregivers of kids with PSE advocate for their child in school? And so I think, Sara, if you have anything to add to some of the tips you've already given us in terms of books, elevator pitch, meeting with the students, would love to hear more. And then Jenn and Shina, if you have any tools or tips for how caregivers can really advocate for their kids in schools.
A lot of it is just kind of being that parent and being okay with being that parent. Is you have to be visible as you can be. If you work full time, that's okay. Email is fine. I have a really bad habit, and I explain this to all of my student staff members, that I will email whenever anything comes into my head. You do not have to email, or you don't have to respond to me right then. If I email you at 1 a.m, that's okay, because I can't sleep and this is stuck in my brain. I do not expect a response right away, but just having that constant communication and being as open and honest as you can, or you feel that you can. That judgment and stuff is pretty strong, but once you kind of put yourself out there, it's a lot easier to keep putting yourself out there. Ooh, and document everything in writing. Always email any conversation that you end up having with a staff member, like a quick conversation at pickup. If it's important, email later and be like, oh, per that conversation we had about you doing whatever, or us doing whatever. Always, always, always in writing.
Great, thank you. And Jenn and Shina, anything to add?
I just want to piggyback on what Sara was saying, and just really safeguarding and protecting our kiddos' opportunities to have maximum mental health, and really safeguarding their mental health by ensuring they get adequate rest. And what I mean by that is, I know for all 3 of my kids, I had it written into their IEP that there was no homework at all prior to high school, because by the time they were done for the day at school, and Shina referred to this, it's a long day. And then when you're trying to exercise skills that you may not have developed yet in executive function and cause and effect thinking, and by the time you get home for the day, you are done, and then you're heading off to therapy, right? And so if you have homework to do on top of that, it's really a challenge. And I agree wholeheartedly with Sara about being that parent. She's definitely got a great approach there, and you do have to be that parent and that voice at times, and document. She got it in one there.
Great, thank you. And anything to add, Shina? Yeah.
Yes, actually, that made me think about the homework thing, made me remember when I had worked in schools before. State standardized testing is not a requirement to put on your kid, and you can absolutely opt out. And for a lot of our kids, they should opt out, because they are going to be graded. They're going to be told these are the parts that you need to do better in. And then every quarter, they're going to look at your scores and be like, this is where you improved, this is where you didn't improve. And it may not be the best route for a lot of our kids. So definitely something to consider is opting out of standardized testing.
Great, thank you. I really appreciate these tangible tools. These are things that I think caregivers can really actively use. And on the flip side of this, so we talked about how caregivers can support their kids and advocate for their kids within schools. how can educators best support and advocate for kids in their classes who might have PSE? And Jenn, maybe we'll start off with you.
Well, I think a big way they can help advocate is by being a team with the parent. So often we want to really push student-led, student-driven, and absolutely that's important. But in the case of our kids, they really need to feel that connection between home and away. And so definitely educators can help support better by being on the same page and maintaining communication with the parent. That's extremely helpful. The other thing that they can do is really advocate for changing the model, changing how they teach certain things. So it's expanding on helping the kiddo develop some of those executive function strategies. They can work with the SLP at their school. They can work with the OT at their school to help develop that, and they can reach out. If, like Sara said, she signs the document every year that allows them to reach out to Hope Rising Clinic. They can reach out to people who are trained in FASD or in prenatal substance exposure and get some support there. There's some wonderful special interest groups or SIGs on educating individuals with FASD and on mental health and FASD. There's resources out there if you know where to look.
Thank you. And anything that you would add to that, Sara?
No, I think those are great. It's that constant communication that is key. That the staff lets me know what goes on because my kid cannot report to me what happened that day. How was your day, buddy? Did you have lunch? Cool, great, bud. That's awesome. But then I can contact his staff. Middle school has been we were terrified of middle school, and it's been phenomenal. He's got a great staff that works with him and works with me. And I honestly probably text his staff, like through our parent communication app for the school district. I know that I text them more than I text my partner. So it's that constant communication is really great.
Thank you. I'm curious, what advice would you give to therapists and providers who are probably working with kids who have prenatal substance exposure, but maybe that's not their primary lens? And Shina, I would love to start off with you. What advice would you give to therapists who are serving this population?
Yeah, so first and foremost, I would like to emphasize re-education on the concept of executive functioning. It's not something that was addressed in graduate school for many of us. For most of us, it's not really part of the graduate school curriculum. And it's not part of the way that things have been taught in general. We are taught to use reward systems, to use sticker charts, to do this first, this, then that, first this, then reward kind of concepts, and just shifting out of that mindset and learning more about these kids that we serve. Because the reality is executive function, even for the kids without prenatal substance exposure, it has an impact. It has an impact on your ability to self-monitor, your ability to communicate, to articulate, to come up with the words that you want to say. Plays a factor in everything. So that would be number one for me, is once I learned and once I re-educated myself on those topics, it really changed the way that I was able to see my clients and serve them.
Great, thank you. And Jenn, is there anything you would add to that?
I think that's a huge piece, learning about the neurobehavioral model and looking at the people you serve through the neurobehavioral lens, and definitely the retraining piece. Yeah.
Thank you. And how about you, Sara? Anything else you want to add to that?
Re-education, I think, is huge. That it totally hits the nail on the head. Executive function there's so much of it that's involved, and it's so huge. But yeah, those are great suggestions.
Great, thank you. So Jenn, this one is for you. What will it take to make these services more accessible to the hundreds of thousands of kids, the millions of kids that could really benefit from specialized services? What will it take?
Funding. I mean, in one, it's going to take some funding. You know, you look at, you've got research. We've been doing the research now for 50 years. You need policy to put it into practice. And without that triad of research, policy, practice, we're not going to see the expansion of services. And that's where, you know, looking at making services more accessible, re-education, looking at the neurobehavioral model and really realizing like 1 in 20, that is a staggering statistic. And we are missing these kids. And if we were to draw some funding in that direction, it would be really well used and well served and would save a lot of problems down the road, right? You know, we look at the mental health issues. If kids are deemed competent and seen as great kids, the great, amazing, funny, kind, smart kids they are, and we're working with them on increasing their skills and as opposed to punishing behaviors, we are going to see such better outcomes down the road. But I think it's going to take advocacy. It's going to take advocacy at a state level. It's going to take advocacy at a federal level. And it's going to take us, like Sara, being brave and strong and becoming those advocates and really having those conversations in this highly stigmatized area of prenatal substance exposure, but having those conversations out loud. You know, when you're in your kiddo's IEP meeting, saying, no, I want FASD to be part of their determining factors in their, I want it written on their IEP. We're not just going to put it as other health impaired. We're going to write that in as a write-in. When we're talking to our legislators and they're talking about mental health, fantastic. Thank you for everything you're doing for mental health. Also, we need to make sure that the mental health interventions that are being brought forward are suitable for this population, because this population exists and it exists at a very high rate.
Well said. And I just want to add to that, speaking of state level advocacy, earlier this year, Representative Tara Simmons sponsored HB 1168, which was a bill to address prenatal substance exposure in Washington state. And Wonderland worked with our partners to really champion this bill. Jenn was a big part of that. And we were so thrilled when it passed unanimously and it was signed into law in May of 2023. And really, this will start the process of replicating Hope Rising Clinic's model statewide so that we can share the model. But there's a long path ahead. And as Jenn said, I mean, funding remains our greatest barrier to serving more kids. So we're really, really hopeful that we can work with the state, we can work with partner agencies to share the model, reach the estimated 165,000 kids in Washington alone who would benefit from these services. We really need to make sure that these kids get access to supports. And if you want to see more about Wonderland's advocacy, you can check the Hope Rising Clinic or Wonderland website under advocacy, and you can see our status there. Jenn has done some just incredible work around the FASD Respect Act. And I'm curious, Jenn, if you want to touch on any other policy or just share any other information on some of those efforts.
Well, I think, you know, this is an opportunity for people to get involved because this is not going to change without the voice of all of us. You know, I started this journey, I was just a mom with an HR background. Right? I don't come to this with a deep love for policy and lobbying, but that is what it's going to take. And so I really encourage everyone to get involved in our democracy by finding out who your 2 senators and your rep are. And here's a hint: in Washington state, it's Patty Murray and Maria Cantwell, but your representative is local to your area. Find out who they are. And you can go on our website at FASD United through our policy center, and we will give you the text of an email that you can send to them, encouraging their support for the FASD Respect Act and its passage. Having those conversations out loud, practicing your 1-minute elevator pitch like Sara's perfected with your legislator is a great way not only to make a difference, but to empower yourself, and better yet, get your kids involved with it. some of our most powerful advocates are our kids with prenatal substance exposure. You know how they have these great verbal skills, but maybe sometimes have challenges interpreting the information they receive back. Well, use those great verbal skills. Use those great verbal skills for advocacy. There was a young man in Kent, actually, that did a presentation to the city of Kent on FASD and got a proclamation there. And 10 years old, right? This is totally possible. So I'd really encourage you to get involved. And then as professionals, we do have an opportunity coming up here in Washington State. The 9th International Research Conference on Adolescents and Adults with Fetal Alcohol Spectrum Disorders is coming in April of 2024 to Seattle. And really encourage any professionals who would like to get more information on FASD and how to work with this population. This is a great opportunity. This is a conference that'll be coming annually to Seattle, and a great way to get involved and get up to speed with some of the great things that we're able to do in the FASD world, and really kind of follow that model and that example that Hope Rising Clinic and Wonderland have set.
Well, thank you so much, Jen. And we will share information out about the conference. We're really excited about that. Last question is there anything else that you want to share, that you want people to know? And maybe Sara, we can start with you. Is there anything we didn't cover? Is there anything that you want people to really understand about your kid and FASD?
The thing that I always want people to understand is that initially there's a lot of focus on babies and small children, and which is great. Early intervention is super important and fantastic, but these kids grow up, and these kids grow up into preteens, and they grow into teens, and they grow into adults, and they grow into elderly people, and they grow into parents, and they grow into grandparents. And that's the thing that I want people to know, is it doesn't just stop when they're little. These are struggles that my child will have for the rest of his life. The lack of support, I hope, is not something that he has to suffer with for the rest of his life. I hope that even after I'm gone, that there is some way, some community, something to help support him for the rest of his life.
Thank you. Really well said. And Shina, is there anything else that you want to share or that hasn't been covered that you want to make sure to say?
I suppose just reframing, speaking to professionals, speaking to other therapists, speaking to all teachers and parents in general. The chances of us engaging with kids with prenatal substance exposure or fetal alcohol spectrum disorders is so much higher than we realize. Like, there's in every teacher's classroom, there's likely to be at least one, for all of our speech therapists out there, it's probably many of them. And and they seem otherwise typical, but to address things from that neurobehavioral lens, and maybe just assuming that perhaps all kids could benefit from some changes in the way that we teach and the way that we grow and show them how to be adults and human beings in this world. If we shift that to a different, model, we might be able to serve more than just the few that we do see.
Great. Well, thank you so much. Very, very well said. I'm going to just pull up a slide here that has our contact info. And I want to just, again, thank our panelists so much. Thank you, Sara. Thank you, Jenn. Thank you, Shina. You all have so much incredible wisdom and empathy and passion that you bring to this space. Thank you so much. Thank you for sharing your own experience and journey. And Wonderland is actively working to fill this service gap. We really want to, again, share the model and serve more kids and more families that are impacted by prenatal substance exposure. We are severely limited in the number of kids that we can serve currently due to funding, which I know, Jenn, is a challenge that you know all too well. And so we really are all in this together, trying to raise the needed funds to make the change that we need to see. At Hope Rising Clinic, we do still have a growing wait list, so we are always fundraising. If you're looking for a truly great cause to support, if you want to support a small nonprofit, a direct service provider, please consider supporting Wonderland and supporting our work at Hope Rising Clinic. I have to tell you, the fundraiser in me just has to tell you that we're currently in our Season of Wonder campaign. So donations made to Wonderland right now through the end of 2023 are being matched. So if you give, your gift could be doubled, could even be tripled. So please do visit hoperisingclinic.org for more information. You'll see a nice big pop-up on our website that can direct you to the Season of Wonder campaign. You can also check out the video that Sara and her son are in. Thank you so much for considering. Every single dollar makes a difference. And please also consider just spreading the word about prenatal substance exposure. Talk about the FASD Respect Act, read about it. There's so much great work happening, and we have a lot of work to do. So please do reach out with questions, and we will pass them along to our panelists. But I just want to thank you guys so much. This was incredibly informative. Thank you for all the work you're doing.